Welcome to the Recovery Centers of America YouTube channel. Please like and subscribe. Turn on the notifications so you won't miss our latest videos.
Sometimes people and their families have trouble understanding both how somebody becomes addicted to drugs and what it means to be addicted. People struggling with addiction often wonder and ask, why can't I stop? And families will say things like, my son or daughter has overdosed multiple times. They've been brought back to life with the overdose shot. The drugs have ruined their life. Isn't that enough to make somebody stop? But simply put, drug addiction is when you can't stop taking the drug, even if you want to. The urge to take the drug is too strong to control, even when you know the drug is causing harm. And unfortunately, when people think they or their loved one might have a problem with OxyContin, heroin, cocaine, or even multiple drugs, particularly if they start looking at the types of problems the drug may have caused. I'm sorry to say this, but at some level, there probably is a problem. We just don't think about having a problem with something that we clearly don't have a problem with. There's very few people who say, for example, to themselves, I wonder if I might have a problem with apples or with broccoli. So now I'm going to talk about the ways to measure a problem, because if you're thinking about it, it's probably there. The way to measure a problem with heroin, cocaine, or other drugs, based on the published and accepted diagnostic manual used in treatment and by insurers to cover treatment, is the same for each of these drugs. According to the medical diagnosis of these disorders, there's 11 symptoms we look for. And it's not a yes or no answer, you are or you aren't. It's divided into severity of the problem. If you have 2 to 3 of these symptoms, you meet criteria for a mild problem. If you have 4 or 5 symptoms, you have a moderate problem. 6 or more symptoms out of the 11, and you have a severe problem. We don't see many people who only meet 2 or 3 symptoms because the nature of addiction, it's almost always 6 or more. So thinking about yourself or a loved one's behavior, here's the 11 symptoms to look for. The first one is, did you sometimes use more or for longer than you planned? So that is, you said, I'm gonna drink until Saturday or Sunday, and then I'm gonna stop, but you find yourself drinking Monday or Tuesday. Or you say, I'm gonna have, 3 beers, and you find yourself having 6. Have you ever wanted to stop or been unsuccessful trying to cut down or quit? That is, you've tried to quit, but you can't. Do you spend a great deal of time using or recovering from use? Getting the drugs, taking the drugs, recovering from a night of drugs. The fourth one is, do you have cravings or strong desires or urges to use? Number 5, has continued use led to problems with work, school, or home obligations, like you're late for work or you miss days or you flunk out of school? 6, have you continued to use despite it causing problems with others? That is, your family's telling you should stop, your friends are telling you should stop. The 7th criteria is, have you decreased or given up social, work, or recreational activities? Did you quit the bowling league? Did you quit, your job? Did you quit hanging out with the friends that didn't used to use? Number 8 is, do you use even when it could be physically hazardous to you or to others, like when you're driving? Number 9, do you use even though it may cause or worsen medical or psychological problems, like your diabetes or depression? Number 10, do you seem to need more of the drug to achieve the same effect? That is, you used to shoot up, use 10 bags of heroin, and now you need 15 to have the same effect. And number 11, the final one, is, do you have withdrawal symptoms when you cut down or you stop using? That's a very important one, because if you have withdrawal symptoms when you cut down or stop using, you could be in for a medical crisis. So again, if you have 2 or 3 symptoms, you have a mild problem, which is pretty rare. 4 or 5 symptoms, you have a moderate form of the disease. 6 or more, you meet criteria for severe illness. If you think that you or a loved one has any level of diagnosable problem, please get an evaluation. Let a professional tell you where you fall on that scale of those problems. If it's a severe problem, you want to get help for yourself or your child as soon as possible. The strength and lethality of drugs are profoundly different than they were even 10 years ago. Cocaine prices have decreased 41% and purity is at a high of 61%. Lower prices, more purity has helped contribute to an 81% increase in the number of first-time cocaine users in the United States. In 2019, the last year we have national data for, an estimated 671,000 people tried cocaine for the first time. That means 1,835 people tried cocaine for the first time every day in 2019. And often that cocaine can be laced with a powerful opioid, fentanyl, as dealers try and get people using cocaine to cross-addict over to fentanyl to assure a steady customer. Likewise, the illicitly manufactured opioid fentanyl is now commonly sold on the street. After the U.S. became aware of the problems with prescription opioids like OxyContin and others, they became less available by physicians. They became very expensive to buy on the street. 80 milligrams of OxyContin costs about $80 on the street, but is the equivalent of about $20 of heroin. And that led to more people transitioning over and a higher likelihood of overdose. But heroin has become actually less available. The synthetic opioid fentanyl has increased in availability. Overdose deaths from fentanyl went from 3,100 to 31,000 in a period of 5 years. So again, if you think that you or a loved one has any level of a diagnosable problem, please get an evaluation. Let a professional tell you where you fall on that scale. Get help for yourself or your child as soon as possible. This is the most deadly time in our history to be using drugs. Thank you.
If you enjoyed this video, please like and subscribe. Don't forget to turn on notifications to see our latest videos. Remember, help is available 24/7 at 1-800-RECOVERY.